Welcome to our channel. Today we're diving into an important topic, common breast diseases in women. You know me, I'm all about what's going on beneath the surface of our skin. But today we're going a little deeper, exploring those hidden lumps and bumps that can cause concern. Understanding these conditions is crucial for early detection and better health outcomes. Just like with those pesky pimples and cysts, early intervention is key. We'll cover a range of conditions, from those that are totally benign and common to more serious issues that require immediate medical attention. Remember, knowledge is power. By understanding the signs, symptoms, and treatment options, we can take control of our breast health and advocate for our well-being. So let's get started. Okay, let's start with a super common one that many women experience: fibrocystic breast changes. It's a mouthful, I know, but don't let the name scare you. Imagine this. Your breasts are like a beautifully woven tapestry of glandular tissue, ducts, and supportive tissue. Now picture little pockets of fluid-filled cysts and extra fibrous tissue popping up in that tapestry. That's what happens with fibrocystic changes. It's like those little bumps under the skin, but instead, they're in your breast tissue. These changes are totally benign, meaning they're not cancerous. However, they can cause some discomfort, especially right before your period. Think about it. Your breasts are constantly changing throughout your cycle, thanks to those hormonal fluctuations. So it's no surprise that you might feel some tenderness, achiness, or even notice some lumpiness. It's like those hormonal breakouts we all dread, but instead of on your face, it's in your breasts. Now, if you're experiencing any unusual changes in your breasts, don't hesitate to see your doctor. They can perform a clinical exam, feel for any abnormalities, and may recommend imaging tests like a mammogram or an ultrasound. Just like when you come to see me for a suspicious spot, getting those images can provide valuable information and peace of mind. Sometimes, a biopsy might be necessary to rule out any other conditions. But in most cases, fibrocystic changes are nothing to worry about. It's just your body doing its thing. Now let's talk about another common and benign breast condition, fibroadenomas. These are basically solid, non-cancerous tumors that feel like firm, rubbery marbles under your skin. Imagine a tiny little marble rolling around in your breast tissue. That's what a fibroadenoma can feel like. They're made up of glandular and connective tissue and are usually painless. I know the word tumor can sound scary, but trust me, these are the good kind. They're like those satisfying pops, harmless and often disappear on their own. Diagnosing a fibroadenoma is pretty straightforward. Your doctor will perform a physical exam, feeling for any lumps or bumps. They might recommend imaging tests like a mammogram or an ultrasound to get a clearer picture. Think of it like taking a peek beneath the surface, just like we do when we're tackling those deep-rooted blackheads. In some cases, a biopsy might be recommended to confirm the diagnosis and rule out any other possibilities. But remember, in most cases, fibroadenomas are nothing to worry about. They're like those little quirks beneath our skin, unique and usually harmless. Let's face it, breastfeeding is a beautiful thing, but it can come with its fair share of challenges. One of those challenges is mastitis, a painful infection that can occur in breastfeeding women. It's like that annoying clogged pore that gets inflamed, but instead of on your face, it's in your breast. Mastitis happens when a milk duct gets blocked, and bacteria decide to throw a party in there. Symptoms can come on suddenly and can be quite uncomfortable. Imagine your breast feeling tender, swollen, and warm to the touch. Not a pleasant experience. You might also experience flu-like symptoms like fever, chills, and body aches. It's like your body is saying, hey, something's not right here. The good news is that mastitis is treatable with antibiotics. Your doctor will likely prescribe a course of antibiotics to fight off the infection, and it's essential to finish the entire course as directed. In the meantime, you can find relief from pain and swelling by applying warm compresses to the affected area and practicing gentle massage. And of course, don't hesitate to reach out to your doctor for guidance and support. Now let's talk about breast abscesses. Think of a breast abscess as a next-level infection, like a cyst that's decided to become a full-blown pimple. It's a collection of pus that forms within the breast tissue, usually as a result of untreated mastitis or a bacterial infection. Imagine a painful swollen lump that's red, hot, and tender to the touch. That's what a breast abscess can feel like. It's your body's way of trying to fight off the infection and isolate it from the surrounding tissue. Now, just like with a stubborn cyst, sometimes an abscess needs a little help to drain properly. Your doctor might recommend a procedure called aspiration or incision and drainage. During aspiration, a needle is inserted into the abscess to drain the pus. Incision and drainage involve making a small cut to allow the pus to drain out. It's like creating a controlled release for all that built-up pressure. Antibiotics are usually prescribed alongside drainage to clear up the infection completely. Let's move on to another type of benign breast condition, benign breast tumors. These are abnormal growths that are not cancerous, and they come in different forms. One example is intraductal papillomas, which are small, wart-like growths that develop within the milk ducts. Imagine tiny little fingers reaching out from the lining of your milk ducts. That's what papillomas look like under a microscope. Now, don't let that image freak you out. These little growths are usually harmless, but they can sometimes cause nipple discharge or bleeding. It's like when you have a small cut inside your cheek. It might bleed a little, but it's usually nothing to worry about. Diagnosing papillomas usually involves imaging tests, like a mammogram or an ultrasound, to get a good look at what's going on inside the breast. In some cases, a biopsy might be necessary to rule out any other conditions. Treatment options vary depending on the size and location of the papilloma, but they can often be left alone if they're not causing any problems. Now, it's important to address the elephant in the room: breast cancer. It's a word that can strike fear into anyone's heart. But remember, knowledge is power, and early detection is key. Breast cancer occurs when cells in the breast begin to grow uncontrollably, forming a tumor. These cells can invade nearby tissue and, if left untreated, can spread to other parts of the body. Symptoms of breast cancer can vary, but common signs include a new lump or mass in the breast or underarm, changes in the size or shape of the breast, dimpling or puckering of the skin, nipple discharge, or redness or scaling of the nipple or breast skin. Now it's essential to remember that not all lumps are cancerous. Many breast changes are benign, meaning they're not cancerous and won't spread. However, if you notice any unusual changes in your breasts, it's crucial to see your doctor right away for a proper diagnosis. Let's talk about ductal carcinoma in situ, or DCIS for short. Think of DCIS as the stage before breast cancer fully develops. It's like finding a pre-pimple. It's not a full-blown pimple yet, but it has the potential to turn into one. DCIS is a non-invasive cancer, meaning the abnormal cells are confined to the milk ducts and haven't spread to surrounding breast tissue. It's usually detected through a mammogram, which can pick up on tiny calcium deposits or other suspicious changes. Imagine a mammogram as a high-powered magnifying glass, allowing doctors to see things that wouldn't be visible to the naked eye. If DCIS is detected, treatment options typically involve surgery to remove the abnormal cells, followed by radiation therapy or hormonal therapy to reduce the risk of recurrence. Finally, let's discuss inflammatory breast cancer, a rare but aggressive form of breast cancer. This type of cancer can be particularly concerning because its symptoms often mimic those of a breast infection, leading to delays in diagnosis and treatment. Imagine your breast suddenly becoming red, swollen, and warm to the touch, almost as if it's inflamed. That's one of the hallmarks of inflammatory breast cancer. The skin of the breast might also appear dimpled or pitted, like the skin of an orange. This dimpling is caused by the cancer cells blocking the lymph vessels in the breast, leading to fluid buildup and swelling. Inflammatory breast cancer tends to grow and spread quickly, so early diagnosis and treatment are crucial. If you experience any sudden or unusual changes in your breasts, don't hesitate to see your doctor immediately. Early detection can make all the difference. Thank you for watching. Remember, regular screenings and a healthy lifestyle are key to maintaining breast health. By being proactive and informed, we can catch potential issues early on and increase the chances of successful treatment. Remember, ladies, knowledge is power. The more we know about our bodies, the better equipped we are to advocate for our health. Don't be afraid to ask questions, seek second opinions, and prioritize your well-being. If you found this video helpful, please like, share, and subscribe for more informative content. And as always, stay tuned for more tips and tricks on taking care of your amazing selves.